Chapter 9, Part 3, Healthcare Workers Aware of Patient's Condition Throughout the Collection Procedure. This is why it's really important that we kind of have small talk with our patients and lift our head up from what we're doing to ask the patient how they're doing, how they're feeling. If so, the patient may need to be moved to a seated position, to a laying down or recumbent position. If a seated patient feels faint, the needle should be removed. Patient's head should be lowered between the legs and the patient should breathe deeply. Healthcare workers should stay with the patient for at least 15 minutes or until he or she recovers or until a nurse or physician takes over. A wet towel gently applied to the forehead or a glass of water. Generally, we don't give patients juice because we don't know if the patient's diabetic. May help the patient feel better, but we do this when they are coherent. Hematomas. A hematoma can occur when a needle has gone completely through the vein, the bevel opening is partially in the vein, or the patient's vein is fragile and the needle is pulled out of the vein when the tourniquet is still in place. Images on 299 gives you some example of some hematomas. A blind stick also is performed, could cause a hematoma, and also if the healthcare worker probes around in the patient's arm for a vein. Sorry about that. Also, healthcare worker fails to hold firm pressure over the venipuncture site, and a blind stick, so inability to see or palpate the vein is performed. And this is the image that your book referenced to. This is the circumstance when we would not draw through a bruise, when it looks like this. If a hematoma begins to form, the tourniquet and needle should be removed immediately and pressure should be applied to the area for approximately 2 minutes. If the bleeding continues, a nurse should be notified so he or she can follow up on the site. Petechiae is small, red, smooth, hemorrhagic spots appearing on the patient's skin. This can be found on figure 9.4 in your textbook. It indicates that minute amounts of blood have escaped into the skin's epithelium, and this is what it looks like. Excessive bleeding. Patients on anticoagulant therapy, such as Coumadin or warfarin, or those taking high dosages of arthritis medication or other medications may bleed for a longer period. Pressure must be applied to the venipuncture site until bleeding stops. We follow up on these patients too to make sure that the bleed, actually confirming, lifting the gauze up and confirming the bleeding is stopped as well. Nerve complications. If the healthcare worker accidentally inserts the needle all the way through the vein, or he or she may hit the nerve below the vein, patient most likely has a sharp electric tingling and painful sensation that radiates down the arm. We're advised to give a patient an ice pack, and it should be applied to the area of inflammation. We're going to release the tourniquet immediately, remove the needle and hold pressure over the blood collection site, and complete an incident report on the occurrence and give it to our supervisor. The other thing too that we want to be mindful and follow up on is anytime that the patient expresses any type of pain, that we do discontinue the procedure. Seizure during blood collection. This is a rare complication, but we'll cover it briefly here. Immediately release the tourniquet, remove the needle. Move the patient to a lying position if he or she has not fallen already. Attempt to hold pressure over the blood collection site and call for help from the nurse's station. No attempt should be made to place anything in the patient's mouth unless the healthcare worker is experienced and authorized to do so. We just want to make sure that they are in a safe area and don't have anything that could potentially fall on them. Hemoconcentration. This is a decrease in plasma volume with increased concentration of cells and larger molecules, caused by several factors, i.e. prolonged tourniquet application, massage, squeezing, or probing a site. Long-term IV therapy, sclerosed or occluded veins could be a cause for hemoconcentration as well. IV therapy. Patients on IV therapy for extended periods often have veins that are palpable and visible but damaged or occluded or blocked. The arm with the IV line should not be used for venipuncture because the specimen will be diluted with IV fluid, and we do not know how long the IV had been running. If unavoidable, the IV line should be shut off for 2 minutes by nursing staff. Then the blood specimen may be collected below the IV site, and we'll actually document this on our requisition. Sometimes the nurse or physician can disconnect the IV line and collect blood from the line that is already inserted, but we are not authorized to do so. It is instructed that if we're drawing below the IV site, we want to make sure to be extremely distal to it. So, for example, if the IV is in the fold of the arm, then we're drawing in the hand. If they are drawing blood from the IV line itself, the first few milliliters of the specimen should be discarded to remove IV fluid, and a note should be made in a laboratory requisition that this step was performed. So in your textbook on 301, they're going to flush the line, discard a volume, and then collect the next 5 to 7 mLs of blood. Collecting blood from above an IV that has been temporarily shut off is not recommended because of possibility for analyte contamination. But we do need to follow policies of the laboratory we work for. Hemolysis. This results when red blood cells are lysed, hemoglobin is released, and serum, which is normally straw-colored and yellow, becomes tinged pink or red because the red blood cells start breaking apart. Common causes: connection of blood collection equipment parts are loose. Tube choice not based on patient's vein, so we use a tube that's larger in volume. The patient's vein can't handle the vacuum or the pressure. Syringe plunger pulled too fast. Prolonged tourniquet application can also be a cause of hemolysis. Too small or too large of a needle used depending upon the vein. Needle readjusted too frequently. Needle blockage occurred due to bevel being against the wall or improper angle, which should be 30 degrees or less for a straight needle and 15 degrees or less for a butterfly needle. Tube shaken or mixed vigorously rather than a gentle inversion. And I apologize for that. Common causes: sluggish, slow blood collection can result in hemolysis and underfilled tubes. Lack of proper handling and transport after collection can also be another cause of hemolysis. This may be a result of psychological abnormalities. Hemolysis causes falsely elevated or increased results for many analytes. Hemolysis also shows decreased red blood cell count, hemoglobin, and hematocrit. I'm going to have you reference to box 9/4 in your textbook. This gives common causes of hemolysis during blood collection that I would like you to review. And this is an image of hemolysis. So this is what our tube's supposed to look like. And this is various degrees to where we get to what's called gross hemolysis, where we can't even identify the color. It's just completely red. Collapsed veins collapse when blood is withdrawn too quickly or forcefully during the venipuncture. This is common in geriatric patients, also can be common in fragile veins. So collapsed veins should not be probed with the needle. Improper collection tube. Learn which common laboratory tests require which collection tubes. So for example, a PTNR is generally collected in a light blue top tube. A CBC, or complete blood count, is generally collected in a lavender. Be familiar with how and where to seek information. So we have electronically via laboratory reference manuals, tests and tube requirements. Your book talks about examples of blood specimens collected in the wrong tube or wrong manner on page 303. Please read over items 1 through 11 in your own time. Use of improper blood collection tubes can affect specimen quality, analytical results, and patient safety. The one thing we want to be aware of is the clinical alert that the healthcare worker should never combine the blood from 2 or more underfilled tubes to provide the patient's blood specimen. This behavior leads to twice as much additive and affects the accuracy of laboratory results. In addition, the healthcare worker is exposing him or herself to a risk of bloodborne pathogen. That is our clinical alert on page 303. The risk of specimen rejection due to underfilled collection tubes can be avoided as follows: holding the collection tube in place in the tube holder until the blood flow has stopped and filling the tubes to their stated volume. But your book does a great reference as to each tube giving kind of an example of why it was collected in the wrong tube in the wrong manner. So just more so for reference, the item 1, green top tubes containing lithium heparin are not suitable for a patient's lithium studies because laboratory values will be falsely high, suggesting the patient has a toxic level of lithium when he or she does not. So they might decrease the patient's drug levels based on our lab results. So this is a great reference for you to understand why it's so important we collect the correct tube. Another thing that I want to reference back to is page 300 and the clinical alert on that one as well. Not leaving the patient until the bleeding is stopped or you've assessed with nursing faculty or personnel about the instance of your patient bleeding. The clinical alerts in this text are really important to kind of make note of because it goes back to the real clinical lab kind of setting and what to do in case of complications, which is what we were covering in Chapter 9. It's really important to note that a lot of these are avoidable, and that can also be a great importance to us giving quality laboratory care for our patients as well. Being aware of this is essential in our lab, and this plays back to our Chapter 3 PowerPoint about ethics and how we do right by our patients. That will conclude Chapter 9, Part 3. That concludes Chapter 9's lecture as well. I ask that you also view the clinical alert on 291 about burn scarred or tattooed areas as you're completing your reading for this chapter. I will have a PowerPoint that shows images of some of the complications for lipemic serum, for example, in another PowerPoint slideshow, just with images from Chapter 9.